Panic disorder is an anxiety disorder where a person has several episodes of panic attacks. To understand a panic attack, it is a sudden episode where a person has excessive worrying and physiological symptoms in the form of choking sensation, tightness of the chest, perspiration, palpitation, tingling in the stomach, numbness of the limbs. Sometimes the person might feel that they might fall down, have headaches, and sometimes the person might think that it is a cardiac episode and they'll end up in the hospital. And when different tests are run through them and when it comes normal, even after telling them that it is not a cardiac episode, again and again they think that it is something too much to worry about, and this is what a panic attack is. And most of the times these panic attacks come unexpectedly. This is how a panic disorder starts, because the person keeps on thinking repeatedly what is it, when the next episode is going to come. Unable to know what is the reason behind it, they keep on thinking regularly and repeatedly about it, and it affects the person's functionality. Now, the panic disorder, the incidence is around 2 to 3% in the population. It is a psychiatric illness, and if we look at the origins, different hormones like serotonin, norepinephrine, epinephrine, and some other hormones do have a role in its origin. Besides this, psychological processes like how we think and how do we interact with the environment has a role of its own. Besides this, what we eat and how our lifestyle is also has a role of its own. For example, caffeine, if we take in a larger amount, can be a panicogen. Besides, alcohol has a huge correlation in creating anxiety issues. So, it is very important that we have a good lifestyle and we choose judiciously what we have to eat. In treatment, since it is a psychiatric illness, medications have a huge role. Medications which work as an SOS basis works very well in panic attacks, and in panic disorders, medications which work on the serotonin system really goes very well. Besides this, psychological interventions like cognitive behavioral therapy, dialectical behavioral therapy, relaxation, and yoga do help in treating this disorder.